הבהרה, התוכן המשודר מבוסס על עדויות אישיות של מרואיינים אשר נאמרו על דעתם בלבד. אין לראות בתוכן משום המלצה כלשהי לרבות המלצה רפואית ו/או נפשית, ואין לראות בו משום עידוד לביצוע פעולות כלשהן.
עין ישראל, החיים שאחרי החיים.
שלום לכולם, ברוכים הבאים לפודקאסט המצולם של עין ישראל. אנחנו בנר שמיני של חנוכה, אנחנו לא יודעים מתי הסרטון הזה יעלה, אבל היום...
דוקטור ג'ף אודריסקול, הוא בעצם עדות חיה לחוויות סף מוות משותפות. מי שלא מכיר את המושג הזה, יש מושג כזה שנקרא חוויות סף מוות משותפות, שגם בהוספיסים, גם רופאים, בין אם זה בטראומה, טיפול נמרץ וכיוצא בזה, עדים לחוויות סף מוות של אנשים אחרים, ולא רק עדים, אפילו שותפים לחוויה עצמה. הדבר הזה נחקר, ובעצם דוקטור ג'ף הוא מישהו שבעצם מגיע מעולם הרפואה והמדע, ומשלב את הרוח לתוך העולם החומרי שלנו.
מבחינת הקהילה המדעית, זה יכול להרוס לך את המוניטין, אם אתה מתחיל להגיד שאתה רואה רוחות וכל מיני דברים שהם קצת מחוץ לנורמה. נכון. אז לקח לו 20 שנה לדבר על זה ובכלל להיפתח.
שלום, דוקטור ג'ף.
Hello, Jeff.
Shalom.
Dr. Jeff.
Thank you for having me on this holy day. Yom Kadosh, yes?
Yes,
Yes.
good, nice. You know some Hebrew?
Very little, not enough to understand your introduction, but I heard Jeff Olson's name, and so I'm grateful to be here and to chat with you both.
Maybe we can start with the experience with Jeffrey Olson.
Now, Dr. Jeff O'Driscoll has become a dear friend of mine, but he was the attending emergency physician in the hospital that they airlifted me or life flighted me into. He didn't know me. I didn't know him. He just knew that they had this horrible accident and they were flying a man that was probably about dead to the hospital. But as his team worked on me in the surgical room, he saw Tamara, my wife, he saw her soul in the surgical room, and she realized that he could see her, and she communicated with him. Very simple, her gratitude. Thank you for doing everything you can to save his life. He's got to raise our little boy, and I'm done. I have left my body. And the doctor at one point shared that with me, and we became friends. He didn't know I had had an experience. He had no idea I had had a near-death experience. He just felt, and it was a nurse, because a nurse saw similar things in the ER room. They came and spoke to me about it, and we've now become dear friends. We've been friends for over 20 years.
The day Jeff Olson and I met, we never spoke. He was flown to my emergency department, to my trauma center from the horrific car crash that took the life of his wife and his 14-month-old son, Griffin. And he was unconscious. That's why we never spoke. He was unconscious. Other physicians were taking care of him when I entered the room. I didn't have to worry about his medical care because other people were doing that already. And so I was able to just take in the experience. And as I walked into the room, standing above him in the air was his recently deceased wife, Tamara. It was as if time slowed down and everything got quiet. It was like turning down the volume on the television. Everybody else in the room was still doing their jobs and talking to one another, but for me it was all quiet, except for Tamara. And she communicated her profound gratitude for the care that her husband was receiving, and she communicated with me. I walked over to the gurney where Jeff was laying unconscious and the doctors were taking care of him, and I checked the pulse in one of his legs. He had a badly injured leg. And I remember when I checked for the pulse, I thought, oh, he's going to lose the leg. They're going to have to amputate his leg eventually. And as I looked down at Jeff on the gurney, I could still see Tamara standing in the air behind me because I could see in all directions at the same time. People ask me how that's possible, and I don't know how to explain it other than to say that when we see with our physical eyes, we get electromagnetic waves that go into our eye, and the retina converts them to electric signals which travel down the optic nerve, and then the occipital cortex generates an image from those signals. But when you see with spiritual eyes, it bypasses all of those physical steps, and you just get the purest of images. And it feels like you're seeing it with your eyes, but if you were, everybody else in the room would see the same thing. And so I could see Tamara, but I could see everything else at the same time in all directions. And that was my experience of how I met Jeff Olson's wife. He and I wouldn't talk about the experience for another month until after he'd had several surgeries, and I went to his hotel room and we had a conversation, and I told him what I'd experienced, and he started to weep, and that's when he told me about his out-of-body experience at the scene of the accident, and we've been fast friends ever since.
Did you feel comfortable to tell him, I saw your dead wife?
I was very uncomfortable. I didn't want to speak with him about it. But there was one other person in the emergency department who knew about my spiritual experiences because she'd had some of her own. In fact, she told me about some of her experiences, and they made me weep.
Wow.
And she had also experienced Tamara's presence that day.
A nurse?
Mm-hmm. And she came to me a month later and said, we have to go tell Jeff what happened. And I said, no, we don't. We don't have to tell him anything. I don't share my personal spiritual experiences with total strangers. But she was very persistent, and she dragged me by the arm to his hospital room. And I stood kind of in the corner and didn't say much. And she sat down at the side of the bed and proceeded to tell him what we'd experienced. And that's when he started to weep. And I acknowledged that, yeah, I'd had the experience. And I had this growing, profound knowledge that day, this understanding that he and I would be connected for decades into the future somehow. And now we've been friends for 23 years. We travel together, we speak together, we do a lot of things together. When I walked out of Jeff's hospital room and I walked back to my car, you'd think that I would be completely overwhelmed and consumed with the profound spiritual experience that we'd shared. And it meant something to me. But what was more powerful than the experiences we just shared with one another was this growing knowledge that he and I someday, there was something in our future to be connected. And I had that knowledge when I left the hospital that very first day we talked.
This is like part of your mission, maybe?
Yes, I know I'm doing what I'm supposed to be doing right now. For 25 years in the emergency department, I had experiences like the one I described to you. On one occasion, for example, I came to work, and as I was logging onto the computer, I felt a presence, and I'd had enough experiences to know what it was. It was the woman in the next room who was unconscious, and they were trying to resuscitate her.
Oh, wow.
They were doing chest compressions. She was intubated. They were breathing for her, and they were trying to resuscitate her, and she asked me for help. And I thought, why would you ask me? But I was in my clothing that I work in, my scrubs, my lab coat. I walked around the corner into the room. Nobody paid any attention to me because I worked there. It was normal for me to be there. There was another doctor running the resuscitation. He was giving orders. Everybody was doing what they were supposed to be doing. My presence was completely insignificant to her medical care. I walked over and I rested my hand on her leg because I've learned that touch is so important in these kind of experiences. And as I touched her leg, she asked me if she could leave. And I wondered why in the world she would ask me that question, why she thinks I would have any insight into it. And she asked me telepathically because she was intubated. She was unconscious. She couldn't speak. And something came to me from some divine place. And I answered back to her silently. Nobody else in the room knew what was going on. I said, if you feel it's the right time to go and you think that's what you should do, I think it's probably okay for you to go. And as I said that, she rose up out of her body and she stood in the air above the gurney and she thanked me. And she filled me with this profound love and light and glory. And then she left. As I walked out of the room, I heard the doctor behind me, who was in charge of everything, pronounce her death in military time. And I thought, yeah, I know, I saw her leave. That was how my day began. That was the beginning of my shift that day. So I had a lot of those kind of experiences working in the emergency department. It's a sacred place.
I know in my soul that it's true, but I can hear people would ask this kind of question. How do you know it's true?
Oh, I don't worry about that at all. I never worry about convincing my critics because I don't have any desire to convince them. I'm just sharing my personal experience. If they want to believe it, that's fine. If they don't, that's fine too. As for me, how do I know it's real? I know because it has gradually evolved over a period of decades. It started shortly after the death of my older brother in a farm accident. I was almost 12 years old when he died. He tipped a tractor over. And I didn't think it really had a big impact on me. And then 20 years later, my deceased brother came to me and he said, you have to go talk with our mother because there's things she's never told you about my death. So that got my attention. I went and talked with my mother. And that day, for the very first time, she said, I always knew where you were in the house before Stan died because I could hear you singing. When your brother died, you stopped singing.
Oh, wow.
And then I realized that it had had a big impact on me. And shortly after my brother died, I started getting messages, sometimes voices, and over the years, as time passed, sometimes I'd see the messenger that was speaking to me. And so I'd grown into this over a period of time. And so when it happened in the emergency department, when it happened with Jeff's wife, or when this woman that I just described, when it happened with her, it felt normal. It felt natural. It felt perfectly in line with what I was supposed to be doing and experiencing. And it never crossed my mind that it was something less than real.
I feel that you are very brave. According to my experience, like talking with doctors, they're like, especially when you have objective experience, who doesn't know, it means that experience that involve with this reality, that you know things that happens here in this reality
while you're
out of the body or not supposed to know things. You know, I also knew about.
You have a proof.
Yeah, kind of a proof, even though you don't need a proof. But I also knew a lot of secrets that I wasn't supposed to know. So I knew things and I came back with them. But the doctors, even when I knew that the doctor was in the cabin or that, nobody asked me questions. They're all like, But it feels like there is a glass wall that they don't want to break.
Yes, I relate with what you're saying. And you said I was brave to talk about this, but no, I'm not so brave as you think, because for 25 years, I didn't speak about it. I didn't speak about it until after I stopped seeing patients in the emergency department. I wondered if it might have an impact on me professionally. Sometimes it just felt too sacred to talk about. And 6 months, about 6 months after I stopped seeing patients, I woke up one day and somehow in my soul, I knew it was okay now to talk about it. And that's when I started to share. It felt like the right thing to do. So when it felt like it wasn't the right thing to do, I didn't talk about it. And when that changed, I did. And so I try to stay on that path. But it never felt like a conflict to me. I felt like science and spirituality were complementary, not contradictory.
Exactly.
And so I viewed my training as a physician, very traditional left brain, Western medicine physician training, as how to understand and take care of the physical body. And the spiritual side of me always knew that there was a soul that dwelt in that body, and you had to care for the soul or the spirit or the essence as well. But they felt complementary, not contradictory to me.
I think this is a pivotal point in our history. Spirituality and science have to emerge, because I think there is such a big question mark here. We can no longer say that the consciousness is made by the brain.
You're in very good company when you say that. My friend Eben Alexander is a Harvard-trained neurosurgeon.
Yes, I know his story.
He was a pure materialist, and he believed that consciousness was created by the brain. After his experience, he had a rare form of bacterial meningitis, and he was in a coma. And when he recovered and he read his medical record from that time, mind you, he's a neurosurgeon, he concluded that his brain was far too sick to have created the out-of-body experience he had. And now he believes that consciousness exists in spite of the brain, not because of it. These scientists are coming around to explore this. It's still a topic that doesn't get a lot of conversation. I'm working to change that. I've organized a conference for physicians to talk about the medical aspects of near-death experiences. All of the speakers and presenters are MDs and MD PhDs, and it's accredited for continuing medical education. It's going to be a very scientific and medically oriented discussion of trying to better understand and further the research about near-death experiences and consciousness.
I'm saying it's so important because here in Israel, most of the doctors, they know about NDE, the researchers, but they don't want to be seen as a doctor lunatic. And in my experience, while I fainted, I was in conscience, and I heard them talking about me that I'm going to die, and it's influenced me. I got very panicked, and I thought, oh my God, I don't want to die. It's not my time. And I'm sure the doctor didn't meant to harm. I know that you trying to influence in that area. Can you tell us about it?
Well, I'm friends with Raymond Moody, he's a psychiatrist, he's an MD. He coined the term near-death experience over 40 years ago. He's been writing and researching on it ever since.
Yes.
One of his attending physicians when he was in training at the University of Virginia was Dr. Bruce Grayson. He's a doctor, an MD, a psychiatrist. He's a friend of mine. He started the Department of Perceptual Studies at University of Virginia to study this phenomenon. Eben Alexander will be speaking at the conference. He's a Harvard-trained neurosurgeon. Dr. Mary Neal was the former chief of spine surgery at University of Southern California. She had her near-death experience when she was trapped underwater for 30 minutes on a kayaking trip in southern Chile. She's a good friend of mine. She'll be one of the speakers. So I have several friends and colleagues who have agreed to participate in this, and it's going to be scientifically oriented. It's not going to be just simply sharing anecdotal experiences. It's more about gathering the science and the facts and the research. When people are given a safe space to talk about it, then they don't feel quite so alone. They're not so timid and reluctant. The average near-death experiencer takes about 7 years before they share their experience, as you know. When I had that change in my heart and I understood that it was okay to share my experience, 6 months later, I'd published my book, Not Yet. And I had a stack of those books in my bag, and I was waiting in the airport to fly to my first organized public speaking engagement on this topic. And this young couple came and sat down next to me in the airport and asked me the usual questions. Where are you going? What are you doing? And when they found out what I was going to be speaking about, the young woman looked at me and her whole expression changed. She said, "My grandfather just died." And he's come to me a couple of times. And initially I thought, why would you share something so profoundly intimate with a total stranger? And then I realized, oh, I'm a safe place. She knows I'll believe her. And so she took one of my books and went and got on her plane. I had been an emergency physician for 25 years. I estimated I'd seen in excess of 60,000 patients. On the plane to my destination, that voice that's spoken to me for decades now came to me again and said, you will help more people with this book than you helped as a physician in the emergency department.
Wow, amazing.
So just talking about it, just acknowledging the reality of it, giving people a safe space like you're doing with creating your chapter of IANDS there in Israel, that is a huge step in the right direction.
The people of wisdom of the Kabbalah, they know this for so many years. Why it's not integrated with everyday life?
It's more integrated than we sometimes appreciate. I grew up in a Christian tradition, and I've studied the Bible extensively.
Mm-hmm.
I also learned Hebrew so I could study the Torah. I have Hebrew roots. I have Jewish ancestors.
Oh.
I love the traditions and the sacred days and the Jewish calendar because I wanted to understand the Torah. It's because I am fascinated by the ancient traditions of different cultures.
Mm-hmm.
And I see how much more alike we are than different.
Yes.
I've studied the Quran. I've studied the Bhagavad Gita. We are much more integrated and alike than we generally appreciate because we get siloed in these cultures and we think that we have the truth and we don't really reach out much to find out that the thing that really separates us the most isn't our differences in beliefs. It's our differences in vocabulary. We use different words to describe the same thing, and then we don't realize that we're talking about the same thing.
That's what I'm saying all the time, that near-death experiences they have no religion, they have no, a background or skin color, or it's from all nations, from all religions, from all. I think that's what we're trying to do here is make people feel, in Hebrew we call it nekuda shebalev, the point in the heart. One near-death experiencer, she said, when I was up and I was with God, and I told him, how should I call you God? They call you in so many names, God, Allah, and it says to her, it doesn't matter how you call me, as long as you call me.
Adonai, Messiah,
Yeah.
Allah.
Yeah, it doesn't matter.
Elohim, God, Source, Spirit. Some of my friends who have had divine encounters have said they asked a similar question about the name. And the response came back was, we don't need names here.
We want people here to know much more about shared death experiencers. And can you share with us a little bit more of things that you have experienced?
Near-death experiences take place when somebody has a catastrophic injury or illness, and they have near-death or clinical death pronounced upon them, and they come back to life and share their out-of-body or supernatural experience. That's a near-death experience. But mind you, when I saw Jeff Olson's wife outside of her body and communicated with her, I was in the middle of a shift in the emergency department. I was not on drugs. I wasn't asleep. I wasn't hallucinating. I wasn't having a seizure. I wasn't having any of the proposed mechanisms to explain a near-death experience. I was wide awake, fully functional, and doing my job. When someone dies and you have the profound experience, that's called a shared death experience. And I'm not aware of any scientific explanation or any attempt by science to explain it, but I'll tell you how I perceive it. I think of life on this earth as if we were in a big room that's kind of marginally well lit, and we can see to get around, but it's not bright. And on one side of the room is this heavy, dark curtain that separates you from this profound, brilliant, bright, wonderful light. And on the other side of the room's another curtain in a similar way. And every once in a while, on the right side of the room, somebody draws back the curtain and a new soul enters. That's birth. And occasionally on the opposite side of the room, somebody draws back the curtain and a soul departs. That's death. And if you're spiritually in the proximity of that veil when it's drawn back, some of that light and glory splashes onto you and you get to experience it for a time with them. If the veil's held open long enough or open far enough, sometimes you get to peer inside. And sometimes you might see somebody you recognize. So that's how I view mortal experience with life and death, and why we have these profound experiences associated with death and birth. I had very profound experiences witnessing somebody being born. And it's because the veil's being drawn back and they're being permitted to move from one realm to the next.
Can you, from your experiences, tell us who is God? Maybe what is God?
Yes, I've had experiences, and they're not the typical answers that you hear people say a lot. Can I share an experience I had that brought me to my conclusions?
Yes, please do.
I walked into a hospital room one day, and there was a patient in there. He was a homeless gentleman, and he was kind of middle-aged. He had long, unkept hair and a shaggy beard, and he had soiled, torn clothing. He struggled with addictions. He was not what the world thinks of as a successful person. He had holes in his shoes, and he'd been walking around in the snow, and his feet were in pretty rough shape. We didn't speak much. We just it was like I knew what needed to be done. He knew what needed to be done. I grabbed a wash basin, I filled it with warm water and put some soap in it, and I sat down at the foot of the gurney. I took off his shoes and I removed the last bits of his socks, and I washed his feet. And something miraculous happened. Everything that was physical, everything that was mortal, that veil that we talked about earlier, it was all drawn back, and I saw who he was. I saw his divine soul, and I was in the presence of God. I went in there thinking I was going to serve this man, and when I came out of the room, I realized he'd come to minister to me, to teach me who I was, because he was the antithesis of everything the world defines as success. And yet he was God. And when we see that in others, we start to see it in ourselves. And I viewed every soul differently since that day, because that's who everyone is. And I came to realize we're always sitting next to God, whether we're in temple or in the gutter.
Yes.
The person next to us is divine. That's who we are.
So can you tell us about the meaning of our souls to be here, coming back from love and to a dual reality?
I asked that question once. I asked, why are we here? And the answer I got was, it's easy to love others when you see their divine nature. You're here to learn to love people when you can't see their divine nature, including yourself. I was pondering once about this God that the world says is intolerant of sin. And I was contemplating in the context of our own divinity, our own divine nature. And how can you not tolerate being in the presence of yourself, right? If you can't tolerate sin, how can God not tolerate sin? And Spirit spoke to me and said, the God that is intolerant of sin is you.
Mm.
See, it gets right at the heart of all of our judgment, which in some ways is the antithesis of love. And interestingly enough, when I've traveled and spoken about this in various places, One of the things that people get really uptight about is this notion that near-death experiencers don't feel judgment. Now, I should say some of them do. There are some who report dark, difficult, hellish experiences. Most of them don't. Most of them do not experience a feeling of judgment at all. Or if there is any judgment, it's a judgment of themselves. They judge themselves. And that really troubles some people. Some people want there to be a judgment. They want somebody pounding the pulpit and pronouncing people good and bad, putting labels on them, categorizing them, and separating them into different spots. And I think the reason that people feel that way is they're afraid if there's not a hard, fast judgment that follows certain rules, somebody might get a better deal than them.
As a doctor, can you please tell us what is the DNA of all of our souls?
That's a difficult question. It's hard to get the science and the soul into the same sentence sometimes. I believe that our souls, our spirits, if you will, are made up of matter, but it's matter that's more fine and pure than what we're accustomed to seeing and experiencing in mortal life. It's not that there's a nothingness, that we're just a nebulous energy. I think our souls, our spirit, our essence is made up of pure, refined matter. I don't know if that answers your question, but that's how I think about my soul.
Is there any common thing for all of the souls?
Yes. They all come from love, and they all return to love.
So what's going on between?
What's going on between?
What do you mean, this life? Yes?
Most of what's going on between is remembering. I had a friend, a holy man, Sadek, yes?
Sadiq.
Sadiq,
Yeah.
Sadiq. He laid hands upon me 35 years ago and he pronounced a blessing on me. And in the blessing, he said, teach people the truth in such a way as to cause them to realize they've always known it.
Yeah.
Wow.
Yeah. Beautiful.
And that's what I do. I love to find people, meet them where they are, engage them as they are, and help them see the next step. And I love seeing the light come on in their mind when they have that aha moment and they say, oh, of course. It's not like they're learning something new. It's like they're remembering.
Yes.
And it's like when you're in spirit. It's when you're out of body and you get this flood of knowledge that you can't, it seems infinite and it comes in an instant. It's just this pure, unadulterated knowledge that flows and we remember it.
It's soul's intelligence.
So there is universal qualities for all of the souls, right? Like if you
Yes.
take the term of love and you split it to all of the qualities of love, justice, peace, doing all those things, this is the universal DNA of the soul that we have?
I believe it is. What we're here to learn is empathy.
Yes.
Pain teaches us a lot. Suffering teaches us things. It makes us, it writes on our soul and enables us to help others. In fact, a messenger came to me one day and said, every experience is to enable you to help someone else. And I said, whoa, wait a minute. I thought experiences were for personal growth. And then I could go help people if I wanted to. And the messenger said, no, the primary purpose of every experience is to enable you to help someone else. You get the secondary benefit of personal growth.
Wow.
So I think that we're here to learn empathy so that we can help each other. Pain makes us all alike. Empathy makes us one.
Yeah, I
Yes.
agree. But like if we are very rude or with too much ego, this is the veil between us and our soul. It's nothing outside. And after coming back here, I felt like this world is so thick, you know. I missed the gentleness in people, and suddenly people who are not gentle. It was like a rock music in my ears, and I understood that you can't be empathic, like listen with your heart, if you don't let the gentleness to reveal outside. So what's your advice to people? Because we don't only want to give the information, we want to give skills to people to live the real life, the real spiritual reality, with the real identity that they have. So what's your advice?
So much of finding our soul, our center, of finding fulfillment in life and our authentic path has to do with realizing who we are and connecting with our highest self to get answers. And the way to do that for many people, perhaps most people, is to get quiet, to get still, to learn how to listen. Because it's not that we're not spiritual beings, it's that when we're in physical form, we're so distracted by things physical, we forget that we're spiritual beings. We don't have time for our spirituality because we're so distracted by the flesh. But I want to make this very clear because I think people miss this a lot. We existed for eons and eternities before we were born. After we die, we continue to exist. We're just here having a mortal experience, and that's valuable. That's important. Don't fall prey to the world and the religions that would tell you that things mortal are bad, that being human is somehow demeaning. It's not true. The whole purpose of us being here is to be human, to have human experiences. If we weren't going to be human, there's no purpose in us coming. And this is what I really want to emphasize for people to remember. Being human does not make you less divine. You are a divine being having a mortal experience. And that's what we're here to do. It's okay to be mortal. It's okay to be human. It's on our divine path. Being human does not make us less divine.
I love what you said, that it writes on your soul. I love it. It's it's the friction of this world. It's the experience that makes our soul grow.
We all grew up in a Judeo-Christian tradition, which is quite heavily laden with what you should do, what you should be. And it's riddled with guilt and punishment and being less than. And that can be problematic for people because they get the mistaken idea that they're here to make no mistakes because mistakes are bad. You can't make mistakes because they're bad, right?
Yes.
No, that's not true. You think about it. The whole purpose of being here is to make mistakes. If you weren't going to make mistakes, there's no purpose in coming, right?
Yeah, that's how you learn, you mean.
So how do you explain
Yes.
most of the people who had NDE, they didn't, including me, want to come back, even though I know the meaning and to coming back, like we all didn't want to come back, and before our soul, she chose to come
reincarnate.
back.
Yeah.
I love the ambivalence in your story, Hila, because you said, yeah, I want to go back. And then when it got close, you go, oh, maybe not. Maybe I made a mistake. I don't want to go back. And you have to remember, too, that there's probably the vast majority of people out there that choose not to come back. We don't know that because they didn't come back to tell us.
Good point.
They chose to stay. frequently the people I've encountered that chose to come back come back for a specific reason. Jeff Olson's wife said, "You have to go back and raise our son."
Yeah.
And some of the mothers I know said they had other children. They chose to come back to raise those other children. So I think it varies from person to person, and this is what you can do,
I feel sometimes people say, wow, we jealous. We want to have this experience. In my heart, like I feel I'm screaming and I'm saying, no, don't ask that, because you have to come back after.
Yes.
And it's not easy to come back after that, but it's much easier to love people after that. And this is our nature. And even the experiences that you had, it's not paranormal. It's the nature of our soul, and it's not like getting something higher than me. This is the soul. It just we never knew that. So if we, inside of every person, there is a part, neshama. God take a part of him and split it to many souls, and made that those souls will forget who they are, just for being remember who they are. It's like God wants to remember himself. And in this reality, it seems to be a conflict, because like, why God want to remember his self part that doesn't remember this is him? Because God doesn't deal with ego. There is no ego. It's all about love. But outside the body, there is no conflict, because life needs to be revealed. And but still people really ask that, like, we are part of God, and God make this part to forget who he is. So how do you explain this paradox, which is not paradox, but here it sounds like paradox?
It's a mortal physical metaphor that you use to talk about God being separate in all these people and then coming back together. And it's an illusion that we're separated. We're never separated. We are all still together. It's totally an illusion that we step into. In fact, I think that my personal feeling is the physical body, including the ego, is the veil. That's what is the veil. That's why when you step out of your body, by definition, there is no veil. You have interact with divine beings and other souls like yourself, because there is no veil that makes you feel heavy and slow and limited when you're out of the body.
Dr. Jeff, thank you so much. And we think it's so important people to hear also your experiences and your shared NDEs. And is there anything you would like to say to the public here in Israel about life, about love?
A couple of years ago, I was preparing to speak to a large group. I take this very seriously. I meditate, I pray, sometimes I fast. And I ask for a message. What am I to share? And on this occasion, the message came very clearly, very directly. Tell them they're enough. Tell them they're divine. Tell them they're loved. That was the message I was given.
Beautiful.
And I share it frequently because it's so powerful. That's who we are. We are enough. We are divine. We are loved right now.
Beautiful, beautiful. Thank you so much. It was an amazing and profound talk, and we're happy to introduce you to our viewers.
To host you, and God bless you.
God bless you.
Jeff.
Thank you for letting me join the sacred portion of your day. It means so much.
Great. Goodbye.
Bye.
Bye-bye. Bye.